the topic of this video is sexually transmitted disease of lesson reproductive health. Diseases which are transmitted through sexual contacts are called as sexually transmitted diseases, shortly as STD. So they are also called as venereal diseases or VD, otherwise they are also even known as reproductive tract infections, shortly as RTI. So these diseases are usually spread through person to person during intimate sexual contact with an infected partner. So infections like hepatitis B and HIV are transmitted sexually as well, being by sharing infusion needles, surgical instruments, etc. with infected people, blood transfusion or from infected mother to baby. So in this picture it is clearly shown how the HIV is transmitted. So through sexual contact or through the infusions of needles and from infected mother to the baby, and through blood transfusions or through infected surgical instruments. So these are the methods by which the STI can be easily transmitted from one person to another person. So usually the people of age of 15 to 24 are prone to get these infections particularly. So please note this, you may get this in 1 mark point of view. So the people of age from 15 to 25 are mostly prone to get these infections. The sexually transmitted infections can caused by any of the microorganisms like bacteria, virus, protozoans as well as fungi. So the bacterial sexually transmitted infections happen to be gonorrhea, syphilis, chancroid, chlamydiasis and lymphogranuloma venereum. The viral STI happen to be genital herpes, genital warts, hepatitis B and AIDS. And trichomoniasis is said to be a protozoan STI, and candidiasis is happen to be a fungal STI. So this question we may get in 1 mark or 2 mark point of view. So what are the bacterial STI if they ask? So please try to note down this diseases as well as for virus as well as for protozoan. And STI caused by bacteria, fungi and protozoa or parasites can be easily treated with certain antibiotics or by even other medicines, so that the diseases which are caused by bacteria, fungi and protozoans can easily be controlled by using antibiotics or by certain other medicines, whereas the sexually transmitted infections caused by virus cannot be treated, but the symptoms can be controlled by the antiviral medications. So it cannot be easily controlled by the antibiotics viral STI, whereas the symptoms can be controlled by the antiviral medications. Whereas by using large condoms can greatly reduce the risk but does not completely eliminate the risk of transmission of STI. Next thing is happen to be cervical cancer. In case of human females, the cervix of the uterus is prone to affect by a virus called as human papilloma virus, which leads to form cervical cancer. So HPV may cause abnormal growth of cervical cells or cervical dysplasia. So the abnormal growth of the cells of the cervix is usually called as cervical dysplasia. So the most common symptoms of this cervical cancer leads to pelvic pain, increased vaginal discharge and abnormal vaginal bleeding. So the risk factors of cervical cancer includes having multiple sexual partners and prolonged use of contraceptive pills. So these two factors lead to the cervical cancer. So having multiple sexual partners and a prolonged use of contraceptive pills. The cervical cancer can be easily diagnosed by a test called as Papa Nicolau smear or Pap smear combined with human papilloma virus test. And the different stages of the cancer can be determined by either any one of the techniques as follows, namely X-rays, computer tomography, magnetic resonance imaging and positron emission tomography scan. So by any one of these scanning methods, the different stages can be easily identified. And the treatment for this cervical cancer is happen to be radiation therapy, surgery and chemotherapy. So the prevention of STDs, how we can prevent the STDs? By any one of the following methods. Avoid sex with unknown partner or avoid sex with multiple partners. The second is happen to be using condoms. And the last step is, in case of doubt, consult a doctor for diagnosis and get complete treatment. So by following any one of these methods, we can control we can prevent the STDs. At present, we have many modern screening techniques which is used to detect the precancerous changes in the cervix. So suppose if there is any change in the cervix, it can be easily identified by applying the modern screening techniques. So therefore, screening is recommended for women of above age 30 at least once in a year. So that the women should be screened once in a year. And cervical cancer can be prevented with the vaccines, or by applying vaccines, the cervical cancer can be prevented. And usually the prevention begins the girls of age in between 9 to 13. So primary prevention begins with HPV vaccine of girls aged 9 to 13 years before they become sexually active. So before they become mature, so this application of vaccines play a vital role in prevention of the cervical cancer. So modification in lifestyle can also help in preventing cervical cancer. Healthy diet, avoiding tobacco usage, preventing early marriages, practicing monogamy. So practicing monogamy in the sense having one partner, and regular exercises can minimize the risk of cervical cancer. So these methods they have to practice so to control the cervical cancer. Already we know 4 microbes are responsible for causing the sexually transmitted diseases: bacteria, virus, protozoans and fungi. So first let's see regarding the bacteria. So the title is given as follows: name of the disease, causative agent, symptoms and incubation period. So this is also very important from 1 or 2 marks point of view. So the first diseases happen to be gonorrhea. So causative agent for gonorrhea is happen to be Neisseria gonorrhoeae, and the symptom of this disease is it affects the urethra, rectum and the throat. As in case of females, it also affects the cervix. So it also leads to pain and pus discharge in the genital tract. Also it leads to burning sensation while passing the urine. So the incubation period of this disease happen to be 2 to 5 days. The second disease is syphilis, and the agent is Treponema palladium is said to be the agent of syphilis. And the symptoms of syphilis can be broadly classified into 3 stages, namely primary, secondary and tertiary stages. The primary stages happen to be formation of painless ulcer on the external genitalia. So on the external genitalia, there may be certain ulcer formation. The second stage is skin lesions, rashes, swollen joints and fever, as well as hair loss. So these happen to be the secondary stages. And the tertiary stages happen to be appearance of chronic ulcers on nose, lower legs and palate, loss of movement, mental disorder, visual impairment, heart problems, gummas, which are nothing but soft and non-cancerous growth. So these happen to be the tertiary stages. So appearance of chronic ulcer in the nose, internally in the nostrils, there may be certain ulcer formation, as well as in the case of lower legs and palate. Palate is nothing but the roof of the mouth. And loss of movement, mental disorder, visual impairment, even the sight also gets affected. Certain heart problems as well as gummas happen to be the tertiary stages for the syphilis disease. And the incubation period is happen to be 10 to 90 days. So this question you may get in 2 mark point of view. What are the primary stages of syphilis and what are the symptoms of secondary stages in syphilis? Likewise, tertiary stages of syphilis. The third disease is chlamydiasis. So the agent is happen to be Chlamydia trachomatis. The symptoms happen to be trachoma affecting the cells of the columnar epithelium in the urinogenital tract. So the columnar epithelial cells of the urinogenital tract is getting affected, leading to trachoma, and respiratory tract as well as conjunctiva of the eye also gets infected. So 2 to 3 weeks or up to 6 weeks is happen to be the incubation period. The last bacterial disease is said to be lymphogranuloma venereum, and the agent is Chlamydia trachomatis. The symptoms happen to be cutaneous or mucosal genital damage. So cutaneous stands for skin as well as mucosal genital damage. So the genital mucous cells also gets damaged, urethritis and endocervicitis. So locally harmful ulcerations and genital elephantiasis. Even it may lead to ulcer formation in the genital tracts. So the symptoms happen to be this, and the incubation period is 2 to 3 weeks or up to 6 weeks for this particular disease. The next is viral sexually transmitted infections, and in which the first disease is genital herpes. Sometimes even the virus affects the genital organs, so to known as genital herpes. The agent is happen to be herpes simplex virus, and the symptoms for this herpes disease is sores in and around the vulva, vagina, urethra in females, or sores on around the penis in case of males, pain during the urination, bleeding in between menstrual period, swelling in the case of groin nodes. And usually the incubation period is happen to be 2 to 21 days. And the genital warts happen to be the next disease caused by human papilloma virus. And the symptoms of this disease is hard outgrowths tumor-like on the external genital organs, cervix and perianal region. So even the region around the anus also gets the symptoms. So the symptoms happen to be this, and the incubation period is 1 to 8 months. The next disease happen to be hepatitis B caused by hepatitis B virus, and the symptoms happen to be fatigue in the sense tired, jaundice, fever, rashes and stomach pain, liver cirrhosis and liver failure occur in the later stages. So even finally the liver may get failure, and the incubation period is happen to be 30 to 80 days. The last disease happen to be AIDS caused by human immunodeficiency virus, and the symptoms happen to be enlarged lymph nodes, prolonged fever, prolonged diarrhea, weight reduction and night sweating. So the incubation period for this HIV is 2 to 6 weeks, even more than 10 years. The third microbe is fungal STI. So candidiasis said to be the disease caused by Candida albicans. The symptoms of this candidiasis is attacks the mouth, throat, intestinal tract and vagina. So vaginal itching or soreness, abnormal vaginal discharge and pain during the urination. So these are the symptoms for this fungal disease, namely candidiasis. The last microorganism is happen to be the protozoan. So trichomoniasis is said to be the disease caused by a protozoan called Trichomonas vaginalis. The symptom of this trichomoniasis happen to be the vagina gets affected, so that to lead vaginitis and greenish yellow vaginal discharge, itching and burning sensation. It not only affects the vagina, it also affects the urethra, epididymis and prostate glands. So to form urethritis, epididymitis and prostatitis. So the incubation period for this disease is happen to be 4 to 28 days. So with that, the topic is getting over. Regarding the next topics, we'll see in the next videos. Thank you.